Is earwax buildup making you miss out on the sounds of life? Today, we're showing you a simple and safe way to clear things up using the CVS Health earwax removal syringe. Let's get started. First, it's crucial to use lukewarm water. To hot or to cold can cause dizziness. Fill the syringe completely with the water. Tilt your head to the side so the ear you're treating is facing up towards the ceiling. Having a towel handy is a good idea to catch any drips. Now, gently insert the tip of the syringe into your ear canal. Do not force it in too far, just enough to create a good seal. Carefully and slowly squeeze the bulb of the syringe. You should feel the water gently flowing into your ear canal. Avoid squeezing too hard, which can cause discomfort or even injury. The water will flow back out of your ear, hopefully carrying earwax with it. Examine the water to see if any wax has been removed. Repeat the process, refilling the syringe as needed, until the water comes out clear or you feel relief from the blockage. Don't overdo it. A few gentle flushes are usually sufficient. Once you're done, gently dry the outside of your ear with a soft towel. Important considerations: if you experience any pain, dizziness, or bleeding, stop immediately and consult a healthcare professional. This method may not be suitable for everyone, especially those with ear infections, perforated eardrums, or recent ear surgery. If you have persistent earwax problems, seeing a doctor or audiologist is always the best course of action. They can provide professional cleaning and advice. And that's it. Hopefully, this has helped you clear up any earwax buildup and get back to hearing clearly. Thanks for watching.